Welcome to today's talk, where we're going to talk about tackling substance abuse. My name is Regina DeMeo, and I'm a family law attorney in Maryland and DC. And I'm very excited to have with me today two people from the Caron Treatment Center. Caron Treatment Center has been around for over 60 years, and Dr. Phoenix Adams is going to be answering some questions, as well as Josie. Josie Tynes is the clinical director at the Caron Ocean Drive Center, and Dr. Adams is the vice president of the Florida Continuum and executive director, also in Ocean Drive. Is that right?
That's exactly right. Thank you, Regina.
Great. So if I could start with you, Dr. Adams, my first question is, I know Caron's been doing this for 60 years. How long have you been helping people with substance abuse issues?
So I've been in this field for just about the last 15 years. I've had various positions in this field, but I've worked with all sorts of different populations, from the very marginalized and oppressed to working with people of wealth. In my roles as a therapist, I've also worked as a grief counselor in hospice, and certainly in working with families, whatever the area of treatment, there's always somebody in the family system that has some sort of level of addiction or problematic use that is, surfacing, that needs to be addressed.
So often my clients complain about a spouse, their partner, that has an issue, but according to the partner, they'll say, well, I am maintaining a full-time job and I don't have any DUIs, so the problem must be you. So with someone like that, what would you recommend for the partner that's concerned about substance abuse?
Right. So I think the important thing about, recognizing that somebody has a problem is not necessarily blaming somebody for the issue, but figuring out what is the impact of the issue and how is it playing out within the system. So, often people, I think, can start by getting help themselves and, figuring out, because it can be very overwhelming. What do I do about this? And, when somebody's problematic drinking or drug use begins to affect the relationship, affect family dynamics, things start, falling apart. But then, as you said, the loved one that is being identified with the problem may be in denial and not necessarily, recognize the issue. It really is a matter of each person being able to have that safe place to go to and say, this is what I'm experiencing. And, first I need help. So it's like that old adage about putting on your oxygen mask on the plane before you are able to help others. It really works that way in therapy also, where you kind of have to look at, okay, how is this playing out for me? What help can I get? And what advice can I get, maybe from a professional, whether it's a therapist or just somebody in the field that can guide somebody to really taking a deeper dive, looking at how the issue is playing out for that person and how we might be able to guide that person to get the help that they need.
So I don't know if you've noticed this, but I see a lot of posts these days during COVID about, the excessive wine drinking. There was literally a back to school supply sign, and then below the back to school sign was a winery. And, behind all jokes, there's always some truth to it. And when I was playing golf the other day with a liquor distributor, he confirmed for me that business is booming during COVID, right? So I'm just kind of wondering if you have seen a rise in people reaching out during this time frame.
Absolutely. And what you're describing is really consistent with how we approach treatment for substance use disorder or addiction anyway. And that is to look at what are the underlying issues, what's fueling the problematic behavior. And in this case, I believe that we've seen a rise in people contacting us for help because there's so many things that have changed for so many people. There's so many stressors. People are out of work. People are home more. So they're actually having to face problems in relationships that are sometimes not as evident when people are working or people are busy or people can travel and people can do all sorts of things. I've heard so many stories of people that their relationships have ended because they had to quarantine for 14 days together and they really had to take a close look at what's actually been going on between them. But I think moreover, as it relates to the way that we do therapy and looking at the underlying issues, we really see that people tend to turn to drugs or alcohol as a means of coping with really unpleasant situations or unwanted feelings or things that they can't handle. So I think as things have progressed with COVID and then all of the environmental stressors and, you know, the fallout from this, people have tended to cope more with drugs and alcohol. So we really have seen an increase in the number of inquiries and people coming into treatment. And I think in addition to that, we've also had clients that have come to stay with us for an inpatient level of care that have stayed longer in treatment than they might have before, because in many cases, they start to feel like, well, I'm here now, I can do this work, I have the time now, where I wouldn't have had time to really focus on myself before. But for many of them, they don't feel like they have great options in going home. So there's been hotspots that they come from, you know, all around the country. And when there's a lot of cases of COVID, they don't necessarily even really feel safe going to their city of origin. So some of them have found a great respite in treatment and being able to focus on themselves, but also to not have to go back to really risky situations.
I think it's also interesting to me that, you know, people who are normally okay during the situation are experiencing for the first time ever situational anxiety or depression. It's because of the situation. We can all agree that COVID sucks, right? And for a lot of us, the coping mechanisms, like I used to do yoga and go to the gym every day. I can't do that anymore. So I guess, how does someone know, understanding that this might just be situational, well, how do you know when it's becoming a problem? Like, what are the signs you would be looking for?
So I would say one sign is lack of connection. So, you know, if you're feeling disconnected from your family, or if you're the family member and you're looking at maybe a loved one is no longer as connected or engaged, that's definitely one sign. From a mental health perspective, as far as anxiety or depression, I would say, you know, change in sleeping patterns, change in eating, change in, you know, level of engagement. Maybe I'm not following up on things that I used to follow up on. Maybe life just seems, you know, as everything's kind of passé, you know, and it's not necessarily as exciting as it once was. And from a substance use perspective, I would certainly say increased drinking, you know, looking at maybe someone who started drinking at 5 or 6 is now drinking at 3 or 4 because they're Zoom meetings and, you know, someone's not going to notice what's to the left of their camera. You know, I would also look at anger too. So if someone is hiding some sort of substance use, maybe they're becoming more angry, they're more agitated, they're not showing up in the same way that they were within the family system. And I could go, you know, on and on about all different potential signs, but I think that's definitely a good start for people to start looking for.
No, that's great advice. I mean, the other thing that sort of fascinates me is we know in the legal field about 40% of lawyers are going to suffer from substance abuse and or depression during their career. And we know from the cases that I've handled that about 50% of divorces have some sort of substance abuse issue. And yet these people are super high functioning. They maintain really high level jobs. And I'm just wondering whether you guys also see that with the people that you work with.
We do, Regina, and that's exactly the profile of the patient that we treat at Ocean Drive. And what we see is that, you know, sometimes because people can be so high functioning, that the problem has more longevity before somebody decides to intervene. I mean, the portrait of the person that you're talking about is generally somebody that, you know, has power, authority, a lot of job responsibility and a lot of job accountability. And when they can continue through life having some success around all of that, it's harder to see all the negative impact that's happening as a result of drugs or alcohol. But you're also talking about people that generally can be resistant to making any changes because it's such a part of their social world and such a part of maybe even expectations of their work world and their relationships where they're entertaining clients. And if they entertain clients, there's alcohol involved. So, you know, there's definitely, you know, those types of things that contribute, but we do see very, very high functioning people, CEOs, executives, business owners, doctors, you know, attorneys. And, you know, I think a really sad part of that is that, you know, as a society, we tend to have a tolerance and an understanding of people that, you know, maybe from less fortunate circumstances. So we tend to not, I don't want to say write them a pass, but we have a little bit more compassion of that. But when we see people in high-powered positions, really as a society, we have less tolerance for that, because many people grow up thinking money solves problems, money buys happiness, those types of things. And people get very invested in that kind of belief system. But the truth is, people in high-powered positions also have difficulty coping. They have the same grief and loss that the rest of us have. They have problems in their family of origin. They have certainly stressors from work, but somehow the expectation is that they're supposed to handle it better than everyone else. So I think what happens is it's harder for these people to step out of their world to get treatment or to admit that they have problems, because frankly, the expectation is that they don't.
Right. So how do you determine whether someone needs in-person treatment as opposed to outpatient?
So a comprehensive assessment is always a good place to start. The American Society of Addiction Medicine actually have a placement criteria that's set into place to look at different markers that people might meet, or once you have a comprehensive assessment, so psychosocial history, spiritual history, substance use history, family history, it really should encompass every part of life or the systems that they interact with. Once you have that data, you're able to look at the American Society of Addiction Medicine criteria and say, what level of care does this individual meet the requirements to be placed into? So, if someone has withdrawal symptoms, then you're going to look at, that's definitely an inpatient situation, because you want to ensure that they're medically stabilized and they're monitored. If someone maybe meets a few of the criteria, but their substance use, isn't to the point that they have some sort of medical complication that could result in the discontinuation of use, then outpatient might be more appropriate. But I would really encourage, a licensed professional as the individual who provides an assessment for anyone who is contemplating what level of care would be best for them.
And what are the options that are available that you guys provide?
So we're here at Caron Ocean Drive and Caron Renaissance in Boca Raton, Florida, and we have a younger adult to older adult program at Renaissance, and we also have our specialty program at Ocean Drive, where we specialize in treating people that you've described, that are the clients that we mentioned, attorneys, business people, people that have quantifiable success in their lives. But we also have our program in Caron, Pennsylvania, where we have younger adult programs. We have programs that are specific for legal professionals. We have programs that are specific for medical professionals. So I think the thing is, we have a variety of different types of programs for people based on their age, some gender specific programs, but really it's a matter of going back to what Josie said and really looking at it from a thorough, comprehensive assessment point of view, and really figuring out what's best for the individual and what kind of issues are they presenting with. So for example, we have trauma-informed programs. So, there might be, somebody that might need a gender-specific program because of a specific trauma that they faced. So we have programs internally that once we assess, we can help determine the best placement for that. And then there's times that even within our own continuum, we might find that doing that assessment, there might be a partner out in the field that is maybe going to be a better fit for those specific needs. So I think going through the admissions process and going through that assessment is something that's really worth it, because one of the things that we pride ourselves on here in Caron is that if we believe we're not the right fit for whatever reason, the important priority is that somebody gets the care that they need, and we want to be able to assist with that placement, whether that's within our own continuum or somewhere else.
So what does the actual treatment process look like?
So I can speak to the treatment process for Ocean Drive, and I'll give you a brief synopsis of, from initial contact through aftercare and what our services look like beyond someone's discharge from inpatient treatment. So, the admissions process is comprehensive. We're going to do a full assessment with the individual or their potential client who's seeking help, as well as any identified or pertinent either family members or people within their within their life system. So we're going to speak to, you know, a husband or a wife or a mother or an adult child, depending upon, you know, who could be identified as potentially being part of the treatment process. Once the assessment has been completed, it is presented to our clinical, medical, and executive leadership team, and a team decision is made as to what the best placement is for that particular client. So what program would be the best fit, what might be a good length of stay, and having that conversation with the client and the family ahead of time. One of our mottos is the patient is the family and the family is the patient. And as I described, you know, the treatment process, I think you're going to see that the family is equally as engaged as the patient is. So once someone arrives to Ocean Drive, you know, they're assigned a primary and a family therapist, and they receive 2 individual sessions with a primary therapist and 1 with a family therapist each week. We also have groups every day. We have a comprehensive addiction medicine consult. We have a psychiatric evaluation. We have a neuropsychological evaluation that's completed. And again, as part of that ongoing assessment process to ensure that, you know, there's no stone that's left unturned. Each individual will have a individualized treatment plan based on all of that information that is obtained through the assessment, and it's going to have goals and objectives on it that are both determined by the client and the therapist, because we really focus on, you know, individualized care and patient-centered care. So we want to ensure that, you know, the individuals that we're working with feel as if they have a voice and they have hope and they have dignity, and, you know, they're treated with respect throughout the process. Once treatment has been completed, which is going to be anywhere from 28 to 56 days, we have an alumni and aftercare coordinator that meets with our respective clients, and we look at providing referrals for each individual locally, be that another treatment provider, or if it's an individual therapist, utilizing SoberLink monitoring, which is a portable breathalyzer system, and also, you know, becoming part of our alumni network, which our alumni are some of the most valuable people within our entire program. And, you know, they have connected with each other. They speak regularly. We have alumni events. You know, we stay engaged with our alumni for, you know, a lifetime, a lot of the time. And, you know, anytime, especially during COVID, if someone's struggling, they can pick up the phone, they can call myself, they can call Phoenix, they can call anyone from the clinical team, and we will be there and we will answer and we will support them. So, you know, treatment at Ocean Drive may start with that initial assessment, but we become part of someone's recovery family, and recovery is for life.
I think you've answered my next question, which was what happens after it's over and they've moved back home. So you're saying that they're still able to reach out and have these connections.
Yep. Absolutely.
They are. And, you know, one thing that we find is, you know, certainly someone might complete treatment and never have the need to come back. But often what we find is that people do what we call first ordered change, where they come in and they might spend 28 days with us. They might spend 56 days with us, but often they find that's enough time to be able to address the immediate situations related to drugs or alcohol. But then they're able to return to their home environments and they realize, well, work looks different, my relationship looks different, you know, other things have changed in my life, and maybe a year into their recovery, things might start to look a little bit different and other issues might come up. So we have a program that we call Progressive Recovery Workshop, where we allow our clients to be able to come back and reconnect with their clinical team. They don't have to relapse in order to do that, but it's just a matter of what Josie said, you know, our alumni contingency is very strong, to come back and reconnect with some alumni, to connect with some patients that are currently in treatment, but most of all to connect with the staff that they've had really great working relationships with, and do a little bit deeper dive on not necessarily work around addiction or substance use disorder, but around maybe what were some of the original pieces that were fueling that disorder that tends to show up later in our lives, even after we think that we've done the work on it. So we keep the door open for our patients and their families to continue that work if they choose to do so, or if the need arises.
Well, it definitely explains why I've heard such wonderful things about you guys for so many years. So if people want to reach you for further information, what would be the best way to reach you?
So our number at Ocean Drive is 561-982-3043. And they can call that number. They could ask for me or Josie, or just ask to get connected to a case specialist in admissions, and someone would be able to begin the assessment process with them.
Okay, perfect. And I think the local contact, is that with Jess Ayer for the DC area?
That's correct.
Okay. Well, thank you so much for taking the time to tune in, and we'll see you next time.
Thank you so much, Regina.
Thank you, Regina.